Hello everyone. I'm delighted to announce that Optometry Australia has secured a significant government grant allocated for the promotion of optometry. The grant, which exceeds $400,000, highlights the government's endorsement of our ongoing efforts to raise awareness of the importance of regular eye examinations for all Australians. Last year, we met with the Minister of Health, Greg Hunt, and pitched the concept of 2020 being a term related closely to good eye health, and that we could really focus the attention of Australians on their eye health during the year 2020. The Minister was keen to support this initiative, and the recent allocation of this grant highlights his government's commitment to the eye health sector and his support for optometry. The COVID-19 pandemic has meant that we've had to pause our 2020 campaign, and to support this, the government has given us until June 2021 to re-energise our Good Vision for Life campaign. This means we have the flexibility to relaunch the Good Vision for Life messaging in 2020 when we believe that the time is right. It is rare that the government allocates funds for promotional campaigns, and on behalf of the board, I'd like to thank the many Optometry Australia team members who were instrumental in securing this grant. The outcome represents a true team effort that you can be truly proud of. I understand this is a particularly stressful time for all of our members, and I want to reassure you that we are doing everything within our power to gain clarification from government as to when restrictions will ease and you can return to practice without caveats. While there has been no enforceable directive from the federal government regarding exactly which clinical services optometry should or shouldn't be providing, based on our discussions with senior government health advisors, face-to-face services that can be postponed without risk to the patient's health or well-being should be postponed. However, the government has also made it clear that patients with chronic conditions should continue to access the care that they need to manage those conditions. They are now also encouraging people not to neglect their less urgent healthcare needs that may escalate if they're not attended to. Based on this advice, we believe it extends to eye care, and we encourage you to employ your clinical judgment and to work with your patients to assist them to manage chronic or emerging eye conditions that may escalate without care. It may be timely for you now to consider when patients with chronic eye conditions and whose appointments you may have postponed or that your patients themselves postponed should be rescheduled. We're also very pleased to have been able to employ 30 of our members on a short-term casual basis to act as our representatives to touch base with as many other members as possible. The reason for this is twofold. Firstly, we want to personally contact you to reinforce that we are here to support you. And secondly, to encourage you to participate in our survey so that we can gain a deeper understanding how you may have been affected by the COVID-19 crisis. Your answers will assist us to ensure that we are supporting you by providing the services that you need and to identify any gaps in service levels. They will also help us to better shape our advocacy agenda by strengthening our position to government and to expand telehealth to support optometry. And thirdly, your responses will aid our Good Vision for Life campaign messages when we recommence promoting optometry and community eye health. It will provide a great foundation for us to really understand how to take this sector forward. When you receive a call from an unknown number, we encourage you to consider answering it, as it may be a fellow member checking in with you on our behalf. And you can also call our member support team, which is serviced by optometrists, if you have any questions or wish to seek advice. This service is available to all members Monday to Friday. Stay strong, stay healthy, and stay well.